If you work in healthcare long enough, chances are you're going to experience something called compassion fatigue. That doesn't mean you don't care. It usually means the opposite, that you've been caring consistently for a long time. So let's talk about what compassion fatigue actually is, what it can look like in a medical office, and a few practical ways to manage it. First, what do we mean by compassion fatigue? It's what happens when your ability to care starts to feel depleted because you've been exposed to stress, emotion, and need over and over again without enough time or space to recover. It's not about one bad day, it's about an accumulation. Compassion fatigue doesn't always look dramatic. Sometimes it looks like feeling emotionally drained halfway through the day, having less patience than you used to, feeling irritated by questions that wouldn't normally bother you. Sometimes it looks like checking out a little, going through the motions, doing your job well, but feeling less connected, or feeling exhausted in a way that doesn't fully go away, even after time off. A lot of people feel guilty when this happens. They tell themselves, I should be able to handle this, or other people have it worse. But compassion fatigue isn't a personal failure. It's a normal response to doing something emotionally demanding over time. So the question isn't, how do I stop caring? It's, how do I care in a way that's sustainable for me? Here are a few tips that actually help. First, learn to notice it early. One of the most helpful tools is simply paying attention to small changes. Ask yourself now and then, am I more irritable than usual? More tired? More detached? These aren't warning signs that you're doing something wrong. They're signals that your system is overloaded. Catching compassion fatigue early makes it much easier to manage. Second, separate caring from carrying. You can care deeply about patients without carrying everything they're feeling with you out of the office at the end of the day. One simple practice that helps is an end of interaction reset. So, after a difficult moment, quietly tell yourself, I cared, I showed up, and I'm allowed to let this stop here. That mental boundary helps keep emotions from piling up over the course of the day. Third, build micro recoveries into your day. You don't need long breaks to recover, especially in a busy clinic, but small resets matter. One slow breath, relaxing your shoulders, unclenching your jaw. Even just 30 seconds can help your nervous system reset. Those small pauses, repeated, protect your energy more than you might realize. Fourth, adjust expectations, not just effort. A lot of compassion fatigue comes from trying to do everything perfectly. Remind yourself, you are one part of a larger system. You're not meant to meet every emotional need or fix every difficult situation. Being steady, respectful, warm, and professional is enough. Letting go of perfection frees up more energy than pushing harder ever will. And fifth, give yourself permission to be human. This work involves real people, real fear, real stress. It makes sense that it affects you. Compassion fatigue doesn't mean you need to leave healthcare. It means you need support, recovery, boundaries, just like anyone else doing demanding work. You're not meant to absorb everything. You're not meant to feel limitless. Taking care of yourself isn't separate from taking care of patients. It's how you stay present, effective, and able to keep going. And if no one's told you lately, the work is hard. Thank you for doing it anyway.